Good morning, and welcome to this COVID-19 situation update from the Houston Fire Department Medical Direction, where we're going to talk primarily about personal protective equipment, the case definition as it currently stands for COVID-19, as well as what to do in case you encounter a patient. For those who don't know me, my name is Kevin Schulz, MD5, and so I want to emphasize first that personal protective equipment is the most important thing you can do to take care of yourself, take care of your families, your patients, the public, and all of your fellow firefighters. Because to become exposed and to become infected will cause significant hardship for both you, your family, as well as potentially for the public and certainly for the fire department. So what PPE should we be wearing? I'll refer you to the memorandum 20-085, which came out on Thursday the 12th, which is going to state about our PPE. First and foremost, on every EMS run, we should be wearing gloves and protective safety glasses. Some form of eye protection should be part of our basic PPE on all of our EMS runs. So make sure you have your goggles or safety glasses or potentially face shields and utilize those on your EMS runs. Next, if your patient that you're encountering has any kind of upper respiratory, lower respiratory, flu-like illness, fever, cough, really any respiratory illness, the next step is to add an N95 mask. And that's going to be an N95 mask for you, as well as some kind of mask for the patient. We do have a supply of surgical masks, which are being distributed. Ideally, put a surgical mask on the patient so that the N95s can be used by our providers. If you don't have a surgical mask, an N95 absolutely will do the trick for the patient as well. Finally, you have to add some form of protection for your body in the event that you have a suspected COVID-19 patient, in which case we're generally using gowns of some kind. One thing to point out is that this is a very fluid situation. There's a lot going on, and there's a lot of people around the country and around the world trying to get PPE. And the Houston Fire Department command staff and logistics have been working hard for quite some time leading up to this event to make sure that we are well stocked to take care of our members. But the PPE that you see may change as this situation evolves, because we're going to supply you with whatever we can to help keep you safe. Now, as I mentioned, initial PPE, gloves and eye protection, PPE for any kind of upper respiratory or any respiratory type of symptoms includes the N95 mask as well as a mask on your patient, and then add the gown or some kind of coverall in the setting of a potential COVID-19, potential coronavirus patient. So what is that patient? And this is a really important thing that you need to understand. There's really three groups of people that we're going to be encountering that meet the case definition as it currently stands for a COVID-19 suspect patient. And I will say that's today. Unfortunately, with this fluid situation, the guidance from the CDC and from the Department of State Health Services is changing. And as soon as we have updates, we will absolutely get them out to you. But for the moment, the case definition we're using is as follows. First and foremost, if you're advised by OEC or by the patient that that patient is on isolation or home quarantine for COVID-19, they've either been diagnosed or they're a person under investigation for the disease, treat them like they have the disease. Go ahead and use your full PPE, including the gown. Next, if you have a patient who has a fever or lower respiratory illness, so runny nose, scratchy throat really doesn't count. It's going to be cough, or it's going to be shortness of breath, difficulty breathing. And they've either encountered a known COVID-19 patient, had close contact with a known COVID-19 patient in the last 14 days, or a healthcare provider, a doctor, a nurse practitioner, someone who's treating that patient says, I think this is a COVID-19 patient and I need y'all to take them to get them checked out. That's someone who we're going to see, and we've already seen quite a few of them at clinics and doctors' offices around the city. And we need to make sure that we're treating those patients, that doctor or that nurse practitioner or whoever that is, they saw something that made them suspicious. So make sure that you're taking their experience, taking their assessment into play, and we're going to treat those patients as if they are a positive for the case. Finally, any patient who has a fever and a lower respiratory illness, a cough, or trouble breathing with a fever, we're going to treat as a possible case. Unfortunately, fever and lower respiratory illness can be a lot of things, but in this particular setting, it can also be coronavirus, it can also be COVID-19, and therefore we need to be really careful and treat these as possible cases. Now, the analogy I like to use when I'm talking about dealing with infectious disease, specifically with COVID-19, it's almost like a radiation exposure. And the way you protect yourself is time, distance, and shielding. So your shielding is your PPE. Your time, as you'd expect, is if I don't need to be close to the patient for a long period of time, I don't want to be. Your distance is the fact that outside a certain distance, you're not exposed to the patient. And that magic distance we're talking about is 6 feet. If you don't get closer than 6 feet to the patient, you're not a risk of exposure. That does not count as an exposure for you if you don't get closer than 6 feet to the patient. So if you have a patient that you need to assess, stop at the door. If the patient looks stable, stop at the door, assess the patient, and then go ahead and if they meet the criteria, have one person get gowned up and get completely into their PPE and step in. There's not really a reason to expose an entire crew for a stable patient if one person can go in to do the assessment, get the vital signs, do the things you need. Expose as few crew members as possible. Now, I will say, if you wear the full PPE, the PPE as it's designed with a gown, gloves, a face mask or safety goggles, and an N95, you're going to be protected. And you, at most, the worst case scenario, that person can be an absolute positive for COVID-19, will be a low risk encounter. If you come close to a patient, stay there for a period of time, there will be risk, there's always risk involved. But it is an extremely, extremely, extremely low risk. And more importantly, a low risk encounter means you won't have work restrictions and restrictions at home that will cause significant inconvenience to you. So, when you're done, you're going to have to, when you take this patient, afterwards, they're going to do a couple things. You're going to fill out the exposure paperwork. I'm not going to get into that. Infection control will help guide you, and you're going to contact infection control. All right, and infection control, along with medical direction, are going to determine whether you fit a low risk criteria or a medium or high risk criteria. And that's really, really, really important. If you fit a low risk criteria, you'll be put on self-monitoring. And all self-monitoring means is you take your temperature twice a day, you report it back to infection control via email, and you'll watch yourself for 14 days to see if you have any signs or symptoms of any kind of respiratory illness or fever. That's it. You can go home, you can be at the station, you can work, you can kiss your wife, you can play with your kids. There are no social restrictions for a low-risk self-monitoring case. If you fall into that moderate risk or high-risk case because you don't wear your full PPE, that's when things become difficult. Because if it's confirmed that the patient is a suspect case for COVID-19 and the hospital or the health department are going to test them, and then you don't wear your full PPE and you fall into the moderate risk category, then you have to go on self-isolation, self-quarantine, which means A, you can't come to work. B, you're going to have to essentially isolate yourself in your home or wherever it is that you're going to be staying. And there are even restrictions on who can be in the home with you, including elderly patients, young children, and patients with any kind of immunocompromise. It's really kind of inconvenient. And unfortunately, we have already had one member who had to self-quarantine. Thank goodness the patient's COVID-19 screen came back as negative, and so the patient is now back to work, and he is fine with no symptoms of any kind. But it's really important to know that if you put all your PPE on, you will never be that medium risk. If you wear your PPE appropriately and you put a mask on the patient, you will always be at least that low risk. And then the last thing to remember or to know is that the CDC recommends that the period of time in which you can be contagious with COVID-19 takes at least a day. So if you are exposed, if we do have something happen and you have an exposure, you can go back to the station, you can fill out all the paperwork, you can collect your belongings, you can get in the car and go home and kind of make the arrangements you need to create that social distancing, to create that self-quarantine. And then you'll have to stay there for either 14 days or until the isolation, or until the patient comes back as a negative test. Those are some of the really important points about this that we want to make sure that you understand. But if you wear your PPE appropriately, if you follow that guideline, and all these guidelines are available, these guidelines and the case definitions are from Memorandum 20-085, which came out Thursday the 12th, and they're all available on this website via link on hfdmd.org. Please read them. Please know them. This is how you're going to protect yourself, protect your families, and this is how you're going to take care of the patients and the patients of the city. Because as Dr. Purse mentioned in a previous video, this is going to spread. And the least we can do is do everything in our power to protect ourselves and to protect our loved ones and our fellow firefighters, as well as the public. Thank you guys, and stay safe out there.